3, 2, 1, and we are live. Dr. Santosh, you can start now.
So good evening, everybody. Myself, Dr. Santosh Kai, the Senior Medical Advisor from the Scientific Services team of USP. And on behalf of USP, I welcome all the eminent speakers to this virtual platform of discussion. As well as I welcome all the attendants or the attending audience who are seeing this Facebook session live. This is the educational program on osteoporosis. It should be a highly knowledgeable and informative session for all the general public who will be viewing this session. We have three eminent speakers who will be discussing on the osteoporosis and the problems related to the diagnosis and the treatment. Just I'd like to briefly introduce the speakers. First, we will have Dr. Usha Sriram amongst us, who is a very eminent endocrinologist, Dr. Kripa, Dr. Manoj Chadha. All three are expert in the field of this endocrinology. So before moving on to this, I would like to just share a corporate presentation of USV. So we'll be sharing the slides on USV corporate presentation. You are a reliable healthcare partner. You see, USV, we are 59 years young in healthcare pharma company. We are the leaders in diabetes, orally, as well as by value, as well as prescription. 1 out of every 5th prescription in diabetes, you see, contains USV oral anti-diabetic brand. We are the leaders in the cardiology segment by prescription wise. We are present in about 75 countries. We are the global leaders in generic metformin. 1/3 of the world's requirement of metformin is supplied by USP. And we have partnership with the multinational companies like J&J for brands like Solicent, that is canagliflozin. And our profound gratitude to each and every one of you, your family, for being an integral part of our journey. Our aim to partner is to ensure better patient care so that India can be recognized as a healthcare capital rather than a disease capital of the world. In this picture, we can see India. This shows that our root are deeply ingrained in our Indian history. In the next picture, we can see that 2 states in Mumbai's business locality are named after our founders. And the ex-Prime Minister of India, Mr. Jawaharlal Nehru, along with Dr. Vittal Gandhi, in a discussion with the Japanese delegation in India. In the lower picture, we can see the son of Dr. Vittal Gandhi, that is Mr. Arvind Gandhi, with Dr. Casimir Fung, who was the inventor of vitamins. Regarding our manufacturing capability, facilities at Daman, Badi, and Nehru. Regarding the quality of metformin in glycomed, if you see the quality of metformin in glycomed is as per the international standard. The NDMA found below the quantification and detection limit. We see the guidance, NDMA level should not be more than 32 ppb, and the quantification limit 12 ppb. Where the detection limit is only 3.87 ppb. So quality of metformin is highly of international as per the international standard. Now the USP brands, you can see glycomed range, glycomed GP, glycomed Trio, Triglycanase, Jalra, Jalra M, Solicent, Piles. If you see the cardiac range, we have Rosde range, Tazloc range, Medzoc range, Ecosprin range, and the Ticaspan range, along with Glynas MF and the Amlopine. We believe knowledge is not enough. We must apply also. Wishing is not enough. We must do also. We want to see the change, be the change. Finally, our partnership with physicians is since last 5 decades. We have awareness program, NDTU 24/7 with the Facebook Live. We have more than 13.9 million viewership during the COVID-19 pandemic. We have the NDCP program to strengthen the education on diabetes. Along with RSSDI, we have collaborated for about 700 plus district level CMEs for diabetes education with primary physicians in the 2020 and 2023. And USV has joined hands with ESH and National Hypertension Working Group to reduce the burden of hypertension in India. We have the IDPP, which is supported by USV to strengthen the research. We have the National Diabetes Educator Program, which has created more than 14,000 diabetes educators in the last 9 years. And the undiagnosed pool, if you see, more than 10 million people have been screened for diabetes and hypertension. So we want to do something for today. The future generations will thank for us. Although we can't change that world, but we definitely can do our bit. So this is our aim of USV. And finally, in the war against COVID or fight against the COVID. We have supported our healthcare partners in the form of PPE kits. About 34.5 lakhs units have been distributed in the form of face shields, fumigation kits, disinfectant spray, hand gloves, goggles, IR thermometers, masks, and several other protective equipments have been provided to HCPs. So this figure is till the 31st October 2020, and the support will still continue. So I thank you for patiently listening to this USB corporate presentation. Now we'll move forward to our agenda for today's meeting. As we know, treatment of sorry, as we know, osteoporosis is a common bone-related health problem, and seen both in men as well as women. And most of the time, it goes undiagnosed until a very severe stage is achieved. Then the patient go to the doctor for the diagnosis or what is the problem, and then he lands up into severe complications. Okay, so what is the aim basically? Diagnose this condition early so that complication related to the osteoporosis can be prevented at the early stage and the steps can be taken in that direction. To discuss this topic, we have amongst us very eminent speaker, Dr. Usha Sriram. I'll just introduce all our speakers. First of all, Dr. Usha Sriram. She is a leading endocrinologist and the leading diabetologist. She has done his MBBS and she is a diplomat of the American Board of Internal Medicine. Also, she is a diplomat of the American Board in the endocrinology. She has tremendous experience in the field of endocrinology and diabetology. Regarding her social work, she has tremendously worked in the social for the social upbringing. In 2016, she has founded a NGO. It is Divas for the primary care and the prevention and the care of the diabetes in the women and the girls. And this NGO basically has trained more than 1,000 physicians in the woman physician basically for the care and the prevention of diabetes in the woman and the girl. So the tremendous social work done by Dr. Usha Sriram. Hats off to her. Besides that, she also started a program known as Fit to Be Mom. That's basically who are reproductive females who are planning for a pregnancy, whatever the needs of the pregnant woman or whatever requirements will be there. For that, this program has been collaborated several along with pharma companies and medical fraternities along with the social media for providing the needs to this woman. So the tremendous social work done by Dr. Usha Sriram. Then we'll introduce our next speaker, Dr. Kripa. She's done an MD medicine and DM endocrinology and DNB. She's working as the associate professor at the CMC Vellore Medical College. She has keen interest in the areas of bone health, osteoporosis, and metabolism. So she has tremendous experience in the field of endocrinology as well as diabetology. Next, I would introduce our next speaker for today, Dr. Manoj Chadha, sir. Dr. Manoj Chadha, sir, has done his MD medicine, DM Endo. He is working as a consultant endocrinologist at the PD Hinduja Hospital in Mumbai. Besides that, she is also working as associate professor at the BOIL Nair Hospital in Mumbai. And he has tremendous experience in the field of bone and mineral research. He has also served as ex-president of the Indian Bone Mineral Research Society in the 2017-19. So with all these eminent speakers for today's, we'll begin with Dr. Usha Sriram to just give a perspective of the osteoporosis. So I'll hand over to Dr. Usha Sriram, madam. Over to you, madam.
Thank you so much, Santosh. Appreciate this introduction, and I'm so delighted to be on this panel with my colleagues, Dr. Manoj Chadha and Dr. Kripa. As president of ISBMR, ISBMR stands for Indian Society for Bone and Mineral Research. I'm the president this year. The former president is Dr. Manoj Chadha. And we are committed to improving the bone health of women and men in our country. And why are we interested in bone health? Primarily because we are concerned about osteoporosis. And osteoporosis is nothing but thinning. Osteo means bone, porosis means thin. So thinning of the bone, which leads to fractures. And why are we worried about fractures? First, the number of fractures that are happening in men and women as they get older keeps rising tremendously. And also the number of fractures globally and particularly in India is rising tremendously again. We need to pay a lot of attention to this condition called osteoporosis. So when fractures happen, why should we worry about fractures is the next question. Can we not just go and get the fracture fixed by an orthopedic surgeon and then we are back to normal? It doesn't happen like that. When someone has a hip fracture particularly, 20% is the chance of dying within the first year of having a hip fracture. The second thing is there is a 30% chance of some sort of permanent disability in their lives. And then an even bigger chance, 40%, 50% chance of them continuing their life with some disability or never returning to previous level of functionality or previous level of activity. So osteoporosis and fractures are quite debilitating and can cause a lot of problems. On top of that, it may, it can interfere with their productivity, their ability to work. It is a major also cost burden for the health system in our country. So for all these reasons, we really have to pay a lot of attention to our bone health and making sure that we do not get a fracture. The good news is that bone health we can attend to that, and it's not like just normal aging that you go from 30 to 40 to 50 to 60 to 70. You can't stop that process. This is not like that. We can slow the process of bone loss that happens over the years and particularly take steps to improve our bone health. So that is what our society is committed to doing. And we are not just on working with osteoporosis, we are working also with other multiple bone health issues. But today we will limit ourselves to talking about osteoporosis. So in essence, it's basically the strength, the quality of the bone, the quantity of the bone that is what is causing the osteoporosis. We normally think of bone as a quiet, dead tissue that is, part of our skeleton, just providing us literally the backbone and then the bones for our movement. And so we don't think of it as anything more than that. But actually the bone is a vibrant, alive tissue uh, undergoing constant remodeling. And I'm going to give you an example, and I learned this from Professor M.S. Seshadri, who was the previous head of the Department of Endocrinology at CMC Vellore. He mentioned this in a meeting, and I have learned that from him. So imagine our road, and there is a pothole on the road. So what happens if we fill the pothole? Then it becomes a smooth road again. Everything is fine. If we don't fill the pothole, there is a gaping crater in the middle of the road. It can lead to accidents. People can fall into it and then have accidents, fractures, or they can, or the car can go over it, or anything can go over it. An auto can go over it, and then that can break down. So it's very, very important to fill this pothole. So imagine the bone like that. So there are cells in our bone that are constantly eating up our bone called osteoclasts. So they keep making these little craters, these little potholes. Then there are cells called osteoblasts that they come and fill these holes and make it back to normal. So this process of eating of the bone, filling of the bone, eating of the bone, filling of the bone keeps going on throughout our life. So this is called bone remodeling. This happens all the time. So anything that interferes with this process will lead to more potholes or more craters in the bone, and then ultimately the bone becomes very thin and then fractures. So what are the reasons why this can happen? One, it can happen because when the baby is born itself, the baby's bone health is not good. So it's starting out with a lower bone mass, or the bone is not in a healthy state, and and that reflects on how good the mother's nutrition was during the pregnancy. And then as the child is growing, very important for the child to get good nutrition, especially protein, adequate sun exposure, enough physical activity. We have to make sure the child is, healthy and is not on some medicines that can cause the bone to get more resorbed, especially medicines like steroids. So these are all the things we must watch out for, especially in children, because there is something called as peak bone mass. We keep building our bone, we reach a peak, and then we stay at that peak for a while, and then gradually the bone keeps, we lose a little bit all the time. Then it reaches one critical point after which fractures start happening. So this peak bone mass happens when we are in our late teens or early 20s. So if a child or an adolescent or a young person is not paying attention to good nutrition, physical activity, sun exposure, and not abusing their health, not drinking too much cola and substances like that, and not on medicines that can make bone loss, then we know that they are not going to get the peak bone mass that they genetically can get. Then from that point afterwards, if it's a woman, she may become pregnant. And after pregnancy, there is breastfeeding. So again, there is bone loss. And then the aging process, slowly with age, we start losing the bone. Then there are things like smoking, excessive drinking of alcohol, excessive intake of caffeine. All of these also increases the risk for bone loss. Then one important event in a woman's life is menopause. So in the first, like the 10 years that follows menopause, or even the 5 years that follow menopause, a significant amount of bone is lost at that time. So for women, we have to pay particular attention because of this menopause. And then there is an age-related bone decline, and gradually the bone comes to one critical point where after that, even the slightest fall um, can fracture our bones. We're talking about hip fractures. There are also fracture of the spine, which causes height loss, which can cause chronic back pain and worsen quality of life. There can be other fractures in the body. So it's really important for us to pay attention to our bone health, just like we pay attention to heart health or health of other parts of our body. This is a very important part of our health, and it has to start from birth and even before birth. The health of the mother from birth, childhood, adolescence, pregnancy, postpartum, then menopause, and then as people age. This is very, very important to pay attention to our health. So our focus through this society is on empowering the community with the knowledge and the tools necessary to promote good bone health. And I hand this over to my colleague, Dr. Kripa, who will talk about how to find out if someone has osteoporosis and how we go about it. Thank you so much.
Thank you, ma'am. A very good evening to all of you. At the outset, let me thank ISBMR and USB for giving me this opportunity. And ma'am has made an extensive introduction on the scope and burden of this problem of osteoporosis. So I'll pick up where ma'am has left off. So osteoporosis, the way I understand in very simple words, is that bones are weak, bones are brittle, and therefore bones may break or fracture. And it is this fracture that is one of the most dreaded complications of osteoporosis. Now, when we did a study in our center a few years back, we found that most women are not even aware of the existence of this condition. And not just that, osteoporosis is clinically silent unless it is complicated by a fracture. And that is why it is so important to preemptively and proactively screen and diagnose this condition of osteoporosis. Now, when we talk about the diagnosis of osteoporosis, I would do this in 3 sections. The first is I'm interested in knowing a bit of history. Second is clinical examination. And third is the various tests that are available. Now, as far as history is concerned, like ma'am enumerated, I'm interested in knowing all the risk factors that my patient might have. For example, how old is she? Advancing age is a risk factor, the duration since menopause, her BMI and weight, her physical activity. What about her nutrition, particularly with respect to calcium and vitamin D? Is she on other medications such as steroids that can increase her risk for osteoporosis? What about addictions such as smoking and alcohol consumption? Besides this, I'm also interested in knowing, does she have a propensity to falls? For example, does she have a nerve related condition? Does she have unstable joints such as osteoarthritis, something known as rheumatoid arthritis that can make her at an increased risk of falls and thereby fractures? So all this I'm interested in assessing. Besides, after this, I would like to examine my patient. Now, when a patient has uncomplicated osteoporosis, my physical examination of the patient may not tell me anything remarkable. However, if she has fractured, particularly if she has multiple fractures involving the spine, she may appear to me to be very short. She may have a twisted spine, which in medical terms we call kyphoscoliosis. We also found in a study from our center that the more the number of teeth loss that she has, the more is her risk for osteoporosis. Otherwise, a physical examination does not yield much. Then why do I need to actually examine the patient in such detail? So there is this entire spectrum of conditions which can be clubbed under the heading of secondary osteoporosis, which means that the patient can have another primary disease which can secondarily lead to a bone loss. So let me start with my own discipline of endocrinology, which is about hormones, too much of hormones. For example, something known as hyperthyroidism, where the thyroid gland produces an excess of thyroid hormones, or a hyperparathyroidism, where the parathyroid glands produce excess of parathyroid hormones. Something known as a Cushing syndrome, where there is an excess of cortisol in the blood, and something known as a hypogonadal state, where sex hormones are less or the patient has not gone through a normal puberty. So all these are conditions which can predispose to a bone loss. Other more sinister conditions would be, for example, the patient has a malignancy that has spread to the bones. The patient might present with excruciating bone pains and fractures. Common malignancies in the male include a prostatic malignancy, and in women might be a breast malignancy. Something of the blood known as multiple myeloma can also cause bone loss. Besides these, there are certain other conditions like, for example, a rheumatoid arthritis, a chronic kidney disease, a chronic liver disease, and the use of certain drugs such as certain psychiatric medications, certain anti-epileptics, glucocorticoids, one of the anti-diabetic agents, pioglitazone. These are all certain drugs that can again predispose to osteoporosis and bone loss. So I'll be interested in knowing on history and clinical examination whether the patient has been exposed to any of this. There is also another condition known as osteogenesis imperfecta. From the term, I'm sure you'll be able to understand that the genesis of the bone is imperfect, or the bone is not formed adequately. This is again another condition that can lead to low bone mass and an increased tendency to fracture. Now, once I have made a thorough examination, then I will proceed with tests. My tests would include blood tests as well as x-rays, followed by something known as the DEXA scan. So what am I interested in blood tests? So again, for me, these I will divide as mandatory and not mandatory. So what I consider mandatory include a calcium with an albumin, a fasting level of phosphorus, creatinine for the kidney function, and an alkaline phosphatase which tells me something about the bone activity. Other tests that I consider not mandatory but preferable if it is available would be the vitamin D levels. 25 hydroxy vitamin D it is called in medical terms. Usually it is so costly that many patients of ours are not able to afford this investigation. Another investigation would be something known as bone turnover markers. Madam very nicely elaborated something about the crater formation and the filling up. So bone turnover markers actually tell us what the bone is really up to. Is it really active or is it lying dormant? This is not required for diagnosis, but it will really help me in guiding and monitoring therapy of osteoporosis. I would also like to do an X-ray, particularly of the spine, which will tell me whether the patient has had any fractures or not. And then I will proceed with something known as the DEXA scan. DEXA stands for Dual Energy X-ray Absorptiometry. So this is a scan that actually makes use of X-rays. It tells me something known as the bone mineral density. This is expressed as grams per centimeter squared. Now, after the machine measures the bone mineral density, this is compared to a standard. Usually, we take a young adult female who is a Caucasian and we compare how many standard deviations is our patient's bone mineral density as compared to the standard. So if it is 2.5 standard deviations or lower than the standard, this is expressed by what is known as the T-score. So if the T-score is minus 2.5 and less, that diagnoses osteoporosis. If it is between minus 2.5 and minus 1, that is a condition known as osteopenia. And if it is minus 1 and above, then essentially the BMD is classified as normal. Now, once I have made a diagnosis of osteoporosis, then I need to think about treatment. Treatment of osteoporosis essentially consists of general measures where I will ensure, like ma'am said, the patient's nutrition should be adequate calcium and vitamin D status. I would promote some amount of weight-bearing physical activity if this is possible, and then specific medications targeted to address the osteoporosis. I'll just explain a few things on vitamin D. Vitamin D is something that the investigation is, there are overzealous tests done for vitamin D. Vitamin D prescriptions are also quite rampant. Now, the normal requirement is 1,000 to 2,000 international units per day. If the patient is deficient in vitamin D, what is recommended is a loading dose. Okay, this consists of 60,000 units. Usually this comes as little sachets with granules or in liquid formulations. This can be had once a week for 8 weeks, followed by once a month. Why do I insist so much on vitamin D and calcium is that the patient should be replete in both calcium and vitamin D for the anti-osteoporosis agents to actually take effect. And this is something that needs to be stressed. You might ask, why not the patient stand in sunlight? It may not always be a practical solution because what is recommended is at least 20 to 30 minutes of sunlight between 10 a.m. and 2 p.m. When patients are particularly elderly and India being a tropical country, the risk of heat strokes, all that needs to be kept in mind. So that is about vitamin D. Dr. Manoj Chadha sir will cover in detail about the treatment, particularly with regards to fall prevention. So I just like to sum up my talk in 5 points. Remember, osteoporosis means bones are weak, bones are brittle, and bones may break. Fractures are the most dreaded complications. You need to preemptively and proactively screen and diagnose, identify all risk factors. DEXA scan is the gold standard. Besides the relevant blood investigations, ensure adequate calcium and vitamin D status in these patients. Over to Manoj Chadha sir for the next session. Thank you.
Okay. Thank you, Kripa. That was wonderful. I think you've done the hard job. So what I'm going to do in the next few minutes is share some slides to make things easier for all of you to understand. Yeah, so Usha and Kripa have given you a background upon how the bones can get weaker. And one of the things that happens is you've seen the elderly getting a hunch. This diagram tells you what both the ladies have explained to you, that they become porous, they become weaker, and they break easily. This is something which ISBMR would like to get rid of. I mean, these are extreme cases of osteoporosis, and I hope down the line these things become extinct and just remain in historical photographs. This is a good family. You can see how with generation, they've been losing height. So Kripa told you that sunlight is the best source for making vitamin D in our skin. One is it has to be in the afternoon, not early morning and early evening as people think. The other thing is that we are dark skinned as compared to the Caucasians. So we don't get that much of vitamin D in our skin. You've been told what not to have, and I want to stress colas, salt. Indians as a race tend to have much more salt than what we really need, and salt can leach the calcium from the bone. And this is another big problem which we don't want to get into. Smoking, alcohol, again, bone robbers, bone poison. So that has to be avoided. The various junk food that we keep hearing nowadays. I think what is important, let's say what we have to do is, if you can tolerate milk, I stress on that, then it is the best form of available calcium, because 1 ml of milk can give you 1 milligram of elemental calcium. We are looking at about 800 to 1000 milligrams of calcium per day. And so probably a good and a cheap source of calcium. The other sources, if you can see, are the non-vegetarian food. In the US, in Europe, milk, juice, dairy products, bread, biscuits, they are fortified with vitamin D. India is also getting ready for that, but that may take some more time. In addition, till is a good source. A lot of dry fruits is a good source of calcium. Wheat contains calcium. Unfortunately, it also contains phytates. So the calcium is not available for absorption. Dry fruits, an expensive form of calcium, but those who don't like milk, then the next thing is to have almonds, dried figs, and the pulses. Greens, beans, peas, these are also good sources. I don't know if I have a photograph of fruits, but chiku, and especially the white part, which we, when we cut the chiku, the white part we just throw away, that is full of calcium. Custard apple also is a good source of calcium. So probably a summary of what I just told you has been put here. Green leafy vegetables, dry fruits, still beans, fruits, cereals. Really, I have put it here, but it doesn't get into the body. And non-vegetarian food, especially the fishes, the bones can also be chewed up. They're very good sources of calcium. Most Indians do not have enough calcium in their diet, and it's been seen that there have been some studies across the country where the average calcium intake instead of 1000 milligrams is about 300 milligrams. So there are different calcium preparations which the doctor will prescribe for you. That's important if the calcium in the diet is not in. Kripa talks to you about the importance of vitamin D, because bone health depends on calcium and adequate level of vitamin D. And although these are sources of vitamin D, I think the important source remains the sun. If you can spend half an hour during the peak time, that means between 10 a.m. and 2 p.m. And since we don't get vitamin D from these other sources, we have to depend upon vitamin D supplementation. Vitamin D testing is pretty expensive. So probably what she mentioned about the various methods of giving vitamin D, the safe way is to give 60,000 units in whichever form, powder, tablet, capsule, liquid, once a week for 8 weeks. And then you get the smaller preparation of 1,000 to 2,000 units daily, or the 60,000 unit preparation once a month is good. There used to be a very popular injection of vitamin D, which can be used once in 6 months, because that is 600,000 units. But we generally try to avoid the use because sometimes doctors tend to overprescribe it, and you get into a condition called vitamin D toxicity. Vitamin D deficiency has been rampant in our country. Studies from North India, South India, West India, East India all have universally said we are vitamin D deficient. But now, because of overzealous supplementation, we started seeing vitamin D toxicity also, which can be serious, especially in the elderly population. And I have seen occasional cases of, coma, altered sensorium, dementia, which was actually due to vitamin D toxicity. So the important thing is, please don't get too much into the detail. The fact is that because of various reasons, the bone mass has gone down. On top of that, the quality of the bone decreases because of certain diseases like the commonest being diabetes. And that's why the patient fractures. So you may have seen so many elderly ladies, thin, frail, walking around, working from morning to evening, no problems. The problem is if they fall down and fracture. So what we need to do is see that they are not only physically and mentally strong, their neurological status is good, and see that they don't fall down. So very simple things: having a well-lit house, having a night lamp when they have to get up to go to the bathroom, no open free rugs in the room where they can slip. There should be railings in the bathroom. So simple things like that can prevent a fall. This diagram very nicely shows you that when you are young, when I say young means 50 to 60, your reflexes are good. You tend to fall down and fracture your hand. As you grow older, these reflexes go down and you fall down straight and you break your hip. So that's why Dr. Usha mentioned hip fracture can be very serious, and it's not enough to say that, oh, we have a good orthopedic surgeon, he'll fix it up. As a Canadian signboard says that hip fractures could be even a death sentence. So we need to prevent these fractures at all costs. There are a whole lot of medications available besides the calcium and vitamin D, but I'm not going to go into that. The important thing is your doctor will decide what has to be given. The important thing is the patient has to take it as prescribed and for a finite period. It could be 2 years for certain drugs, it could be 5 years, 6 years, or 10 years also. So depending upon the type of medication that you are given, you need to see that you take it for the right time. Walking is very good. Swimming is a good exercise for the heart and the muscle, but not for the bones. Stretching is good. Sunshine, I repeat, always is good, makes your bone happy. Now, I like to show this slide in the end because this bird, an ostrich, puts her head into the ground and feels no one can see and everything is fine. We need to get our head out of the ground. We need to understand that osteoporosis is a serious disorder and probably one of the most preventable disorder. The last word is what Usha started first. You need to start preventing osteoporosis not at 50, 60, but when the child is in the mother's womb, when the child is born, child is growing, see that they get a good peak bone mass. Peak bone mass is like your provident fund. You're going to retire before you are 30, and then the rest of your life, you're going to live on that peak bone mass. So please work towards preventing osteoporosis. I'm going to stop sharing and probably we'll take the discussion forward. Santosh, you can take over.
Yeah, thank you all the respected speakers. It's a very nice session, all the three speakers. Just like to sum up whatever all the speakers had said. Firstly, Dr. Usha Madam, I just discuss about the osteoporosis problem. I just try to sum up a little bit. Uh, as you said that in osteoporosis, the bones are brittle and the cells known as osteoblasts are there. They basically are the bone forming cells and another cells are the osteoclasts. They are the bone removing cells. Whenever there is overactivity of the osteoclasts, there is a more of bone removal and the bone becomes more of a porous. Okay, that's a hyperactivity of these cells. This happens in osteoporosis. And as Madam mentioned, it's better to start early, the prevention of osteoporosis, than to wait at a later stage when the fractures are occurring. It's always better. Prevention is better than cure. It is always said. Okay. So that was the problem of osteoporosis and commonly seen in postmenopausal women and elderly, especially the bones, spines, and the hip bones commonly involved in the osteoporosis. This was a brief introduction by Dr. Usha Madam. Then we'll move on to the Dr. Kripa had mentioned about the diagnosis of osteoporosis. As she mentioned, with vitamin D levels, calcium levels, along with alkaline phosphatase, the renal tests like serum creatinine, along with one important test she mentioned, a DEXA scan. Okay, it is a very important gold test basically for osteoporosis. And the score of minus 2.5 and lower indicates osteoporosis. And one more important thing, interesting thing she mentioned, it is a falling of teeth. It's also a very early sign of osteoporosis. That should also be watched for, especially in an elderly woman or postmenopausal woman. Then Dr. Chadha sir discussed the treatment aspect of the osteoporosis. As always, the sunlight is the cheapest and the best, or the poor man's medicine is always said. Anybody can go and have this medicine. It's for free, no charge. So sunshine medicine, as vitamin D is also known as. So sun is a very good source. Then sir mentioned about the dietary aspects, milk, the seafoods, the beans, the dry fruits, the almonds are also a good source of calcium and vitamin D. So always go for this food supplement rather than going on for this medicine supplements. Also sir mentioned about green leaf vegetables, fish, okay, and better to avoid the bad habits like smoking, alcohol. As sir mentioned, smoking and alcohol are the poisons for the bone. Again, should avoid falls and fractures and care for the elderly. It's very important because once the fractures occurs in elderly, they can land in severe complications. So always prevention of fractures in the elderly is very important. So this was the three important messages I think the audience would definitely love to have. Now there are some certain questions in our chat box. We'll select to ask.
Yeah. We seem to be focusing on postmenopausal women.
Yes, we have.
And I remember as a student 30 years ago, we were taught that males don't get osteoporosis. But that is far from the truth. Males who are living longer do get osteoporotic. And it's been shown that the incidence of hip fracture actually is the same in males and females and can be even more dangerous in males than females.
Right. Yeah. So men and women both are equally at risk for this osteoporosis. So prevention, as mentioned, Madam mentioned, is very important. Now we'll move on to the questions. I'll first would like to ask Dr. Usha Madam. Some questions have come up. But one thing I just like to add on, Dr. Usha Madam, I just forgot to mention, she is also working as associate professor in the Rush University in Chicago. Besides this, honorary professor of medicine in the Sri Ramchandra Institute of Medicine at Chennai. So with this brief introduction, I'd like to add on to Dr. Usha Madam. And ask one question is there, does vitamin D oversupply have any effects on the health? Usha Madam, your comments on that?
Definitely. I think Dr. Chadha alluded to that. It's called vitamin D toxicity. So, as they say, even good things, there's something called as too much of a good thing. You should not take too much vitamin D. So, first thing is naturally occurring, from sunlight when we get vitamin D, or from food sources. There are 0 food sources for vegetarians, 0 vitamin D. Vitamin D is only available in non-vegetarian food sources like fish and eggs and foods like that. And in our country, milk is not fortified with vitamin D. I think it's just coming now. 1 or 2 companies are starting to do that. But in the West, milk is fortified with vitamin D. Other foods are fortified with vitamin D. So the deficiency is not as much as we have. but they have a different problem, which is they may have months and months of no sunlight. We have plenty of sunlight throughout the year, but as both Dr. Kripa and Dr. Manoj mentioned, it's not early morning or late in the evening, but somewhere between 10 and 3 o'clock. That is the time the UVB rays, we get the vitamin D. So we have to expose, ourselves to sunlight at that time for about 20 minutes or so. So there is a condition called vitamin D toxicity. So we like to keep our level of vitamin D somewhere around 30 nanograms per deciliter. It can go up to maybe 50, which will be, good. But as we start going out of that range and going closer and closer to 75, 100 especially, or more than 100, then symptoms and signs of vitamin D toxicity happen. And vitamin D is stored in our fat. So if we take too much of vitamin D, and I just want to mention during COVID-19, because there's a lot of what I like to say, the University of Google and WhatsApp, people hear a lot of stuff about how good vitamin D is for COVID-19. It's good, but we can't take too much. Many people were taking this 60,000 units, more frequently or for weeks together. So it's supposed to be taken only once a week for about 6 to 8 weeks, which will bring up our level fully. And then we have to go on a maintenance dose, which is once a month or something like that. But all of this really under medical supervision, because people may have other conditions that may make their vitamin D level go too high. For example, kidney problems or something. So really important to do these things under medical supervision, and based upon the doctor's recommendations about measuring the level or monitoring the level. All of those things are only under supervision. And that's why toxicity, people will feel very sick. They don't have an appetite. They can get nauseated. They can have vomiting. They can have constipation, extreme tiredness. So these are the usual symptoms of vitamin D toxicity.
Yeah, so the expert opinion is vitamin D is useful, but should take under medical supervision and the proper dose. Yeah, so next question I would like to ask Dr. Kripa. I think almost the same. Does with a high dose of vitamin C and D will help in COVID-19? I think almost the same question, but a different angle they have asked. I think Dr. Kripa, you are muted. The mic is muted. Huh? Yeah.
I think ma'am has answered that question.
Yeah.
A lot of talk about vitamin D and COVID-19, and this has been going on in several groups and on Google. I definitely agree with ma'am in that too much of anything is bad. So they should ideally be replete in vitamin D, but it does not mean that taking an excess will prevent or probably alleviate the complications. Though several short trials have actually shown some benefit of vitamin D. It is not something that can be established with certainty at this point of time, but I would encourage that the normal dose that is required and that is recommended, this may be taken.
Right. And similar question on these lines for Dr. Chadha sir. Will diet help to reduce the COVID-19 conditions or symptoms?
I think what you heard, keeping yourself away, distance, social distancing, as they've been talking about, and sanitizing your hands and keeping your place clean around. And just the regular supplements that we've been talked about,
Yes.
they will take care. But beyond that, if you get COVID, you will get COVID. I mean, it's not that because you took vitamin D or you took vitamin C that your COVID will go away. So you have to try to prevent it.
For the prevention, it is there, but not for the treatment. I think that's the message. Yeah. Next question I would like to ask Dr. Usha madam. It's come from doctor. How much vitamin D is important for heart health? Can you please guide me?
So, like I said, there is we need to optimize vitamin D. we try to keep it around between 30 and 50. And so, I mean, usually what we recommend to our patients is that they, get, if they can get food sources, they get that, they get adequate sun exposure and all those other things that we talked about, in terms of osteoporosis prevention, do all that. But just focusing on vitamin D, at this point, we recommend it more for generally good health. Um, if the patient is deficient in that, we replace it. Or if they're having specific symptoms, for example, they're coming with body pains, or they're coming with muscle cramps, or they're coming with what we call proximal myopathy, which is the muscles of the thighs or upper arms and all that. When climbing stairs or doing things like that, they have extreme muscle weakness, or they have generalized fatigue. So these are all things that are symptoms of potential symptoms of vitamin D deficiency, and then we check them and make sure that we replace them. Or if we have diagnosed osteoporosis, we always check the vitamin D and also replace it first, because two reasons. One is the vitamin D deficiency itself can show the bone as being as lower bone mass even on a DEXA. The second thing is, if they are low in vitamin D and we go ahead and give them some medicines for osteoporosis, this vitamin D deficiency can actually get worse, and patients can have more bone pain and things like that, and they're not very happy, and we shouldn't be doing that. So we have to check the vitamin D and normalize it first, and then only give the osteoporosis treatment. And this is necessary in like 40-50% of our patients with osteoporosis. So it's really important. So that's another time we would definitely do this. But for the general population, for example, you would hear a lot, vitamin D prevents diabetes. Vitamin D prevents diabetes complications. Vitamin D prevents heart complications or Parkinson's disease. So many things. So those are all what we call observational data. I mean, the observation has been made, but clearly the link and also the proof of if I treat the vitamin D deficiency, will their diabetes or heart health or all of those things get better? We don't have strong evidence for those things. So as physicians, we have to make sure that your vitamin D is good and you're healthy.
Right. Maintaining optimal vitamin D, I think, is the key to the better health, heart health, as well as your diabetic complications, plus other any cardiovascular complications. Next question for Dr. Kripa is, I think, related to diet. They are asked, which diet should be taken with vitamin D for reducing the weight or heart disease? Again, I think this is little directed toward the weight loss.
Yeah, I don't think vitamin D is an answer to reducing weight. Optimal levels are somewhere between 30 to 75 nanograms per ml. Like ma'am said, vegetarian food is not very rich in vitamin D. Fish is good, I would say. Apart from that, apart from sunshine, if there is vitamin D deficiency, supplement with commercially available supplements. That is what I would say.
Right. We'll move on to the next question, Dr. Chadha, sir. For Dr. Chadha, is it any relation between vitamin D deficiency and diabetic complications?
Dr. Usha has clearly answered the question. As of now, there is no proof. So,
right.
You see, association that has been described, but it's not cause and effect.
Right.
So please let's finish the discussion on vitamin D, saying that vitamin D is for bone, is good for muscle. Beyond that, it is all conjecture.
Right. The next question is, why osteoporosis is common in post-menopausal women? I think, madam, can you just throw some light? I think.
Sure. See, when the hormone estrogen that women have is necessary for the building of the bone. It's very, very important. So the hormone works on those cells that we talked about, the osteocytes, osteoclasts, osteoblasts, and all of those things. So when there is, during menopause, the estrogen levels keep dropping, and then they come to a very low level. And when that happens, naturally the bone loss also becomes much more. So women lose a big chunk of bone, around menopause, and the first 10 years or so after menopause, they lose a lot of bone. So as it is, their peak bone mass is a little lower than that of men. And then they have gone through pregnancy, breastfeeding, and so it's gone down a little lower. And then gradually there is a loss, and at menopause, a big drop. So then they reach a point below the threshold for fractures, which is why women tend to fracture about 5 to 10 years before men. So it's so important to make sure that we pay attention to both men and women. But in women, because of these other natural events that happen in their life, they are more prone to bone loss. And then in our country, there may be other what we call social determinants of health, lack of awareness, access to food. Women may be getting less healthy food than men. They may be eating less than the men in their life. So those are all things that we have to be careful about. And they also do a lot of physical work at home, which may make them more prone to falls and things. Dr. Chadha recently presented a case in our conference where the woman was carrying a baby. The grandmother could be carrying a baby and then had a fall and had a fracture. So there are also more reasons for them to fall and fracture. Yeah.
Right. Yeah, I think woman is continuously under stress, not pregnancy, lactation, then again, lot of household work plus lack of exposure to sunlight. So that makes her more, menopause. So that makes her prone to weak bones and osteoporosis. So that's what. Another important question is there any relation between osteoporosis and diabetes? Yeah. So I think already sir has answered, but again the question has come in a different way. Dr. Kripa, if you can show some light. Yeah.
That's a very important. That's a very important point that has been raised. Diabetes definitely predisposes to bone loss. Now, the problem in diabetes, that is, there are two types, type 1 and type 2. Usually in type 1 diabetes subjects, we see on DEXA scan, they have a low bone mineral density, which is in keeping with bone loss or osteoporosis. But paradoxically, what we find in type 2 diabetes is that the bone mineral density as measured by a DEXA scan is actually higher. Some studies have actually shown that they are higher than even non-diabetic control subjects, and that is the problem. But despite this higher BMD is not necessarily protective. They fracture more, which means that although quantitatively it appears that bones are strong, qualitatively they are not. There are other little, what is known as microarchitectural changes in the bone that actually predisposes them to fractures. So BMD as a standalone tool actually may not suffice to diagnose bone loss in these subjects. There are other softwares that are available on the DEXA machine, something known as TBS. I don't think I'll go into the details and depths of that. This is called trabecular bone score, which may be measured in diabetic subjects. They can fracture easily. So several other things need to be looked at in combination before we initiate treatment for bone loss in a subject with diabetes.
Any comments from Madam?
No, I also just want to, that's a great explanation by Dr. Kripa. Just also want to say that people with diabetes, there are other things like their vision may be poor, they may have poor coordination due to neuropathy, or the low sugar may make them dizzy, or they may have some, dizziness due to high blood pressure that may be along with the diabetes. So these other things that are going on in their life, in their life, like their vision or their feet or this kind of low sugar, makes them more susceptible to, more prone to falls. And when ultimately, I'm so glad Dr. Chadha talked about the fall prevention in detail, because ultimately, even if our bone is thin, we usually will not fracture if we don't fall. So it's so important that we, tell our patients and our, men and women in the community how to be careful about fall prevention. So this is another reason why people with diabetes have more fractures. We really are very concerned about that, because in our country, India alone, we have something close to 75 to 80 million people with diabetes.
Yeah.
So
Yes.
if we can prevent fractures in even this group, it'll be a great help for the community.
Right. It will significantly reducing the morbidity of due to diabetes, I think. Yeah. Dr. Chadha, sir, any comment on this? Or,
I think
okay. Yes.
we are working towards getting awareness and relation between diabetes and osteoporosis. And hopefully, we'll be hearing much more about this in the near future.
We have finished with almost all the questions. So we'll go to the conclusion of this session. I'd like to ask all our respective speakers to give a message to our audience who are listening to this Facebook live session on osteoporosis. What message you would like to give our audience for the prevention, for a diagnosis or treatment, for general health of a public? So I'll just begin with Dr. Usha, madam. So
I only have
yeah.
one thing. Don't listen to anyone that you on WhatsApp or Facebook or Google or anything. It's important to have milk and dairy products. Agreed, as Dr. Chadha said, if it agrees with your stomach and things like that. And make sure that throughout your life, eat healthy, be physically active, build the muscles, and avoid smoking and drinking, and seek periodically especially women after menopause, and men by the time they reach about 60 years, go for a bone health checkup. Just like we go for diabetes checkup or heart health checkup, we need to also have a checkup for our bones. So that's what I would suggest.
To Kripa, your message for the audience. Yeah.
Again, I agree with Usha ma'am. Secondly, I would say early diagnosis, timely screening, and appropriate treatment. So, in your family, if you have elderly mothers, grandmothers, aunts, sisters, make sure that they are screened. Osteoporosis, remember, it is clinically silent unless there is a fracture. So, don't wait till a fracture has occurred. Preemptively and proactively screen your elderly lady relatives.
That's a very important message. Thank you, Dr. Kripa. Dr. Chadha, sir, your concluding remarks for this session. Yeah.
So, probably repeating myself,
Yeah.
osteoporosis is one of the very few preventable non-communicable disease. We can do a lot for diabetes, cancer, thyroid, cholesterol, but really we're not making much dent. Osteoporosis is something we can work on. So we want to prevent the first fracture. Probably not very successful up till now, but the focus now is on preventing the second fracture. So capture the people who already had the first fracture so that we can focus on them and then work on the bone health of the whole population, which can come later on.
So always better to prevent rather than go for a treatment strategy. So it's very important message, and so the wonderful talk and great discussion and learning with all the three eminent speakers. I thank Usha madam, Dr. Kripa, Dr. Chadha sir for this very lucid and informative session. It was a great information for all the audience who have been listening to this Facebook live session. So I thank all the speakers as well as the audience who are listening to this patiently, and hope to continue this session in the future as well. With this, I would like to go for the ending of this session. Thank you all. And good
Thank
night,
you
sir.
so much.
Good night,
Thank
sir.
you.
Thank you, sir. Yeah, technical team. Yeah,
Offline, please, Srishti.
yeah. Yes. Yes.